Identify the source of bleeding at the tissue surface. Apply FLOSEAL matrix fast to the deepest part of the wound or lesion, the source of bleeding at the tissue surface. This is the target site for FLOSEAL hemostatic matrix application. Do not inject FLOSEAL into blood vessels. Do not apply FLOSEAL in the absence of active bleeding. The flowable nature of FLOSEAL allows it to conform to any irregular wound geometries and be applied in difficult-to-reach locations. After creating a cone-like mound of FLOSEAL over the bleeding site, immediately and gently approximate FLOSEAL to the bleeding surface with a moistened gauze sponge for 2 minutes. FLOSEAL granules allow high concentrations of thrombin to react rapidly with the patient's fibrinogen and form a mechanically stable clot. FLOSEAL granules have a maximum swell volume of approximately 20%, which is achieved within 10 minutes and physically restricts the flow of blood. FLOSEAL can be reapplied if necessary. Reapply at the base of the wound and backfill the lesion. Once hemostasis is achieved, gentle irrigation should always occur to remove excess product that has not been incorporated into the clot. Do not disrupt the clot by physical manipulation or suction. FLOSEAL allows visualization of the surgical site both during and after application. Biocompatible and fully resorbs in 6 to 8 weeks, consistent with normal wound healing.
FLOSEAL hemostatic matrix indications. FLOSEAL matrix is indicated in surgical procedures other than ophthalmic as an adjunct to hemostasis when control of bleeding by ligature or conventional procedures is ineffective or impractical. Important risk information. Do not inject intravascularly. Do not inject or compress FLOSEAL matrix into blood vessels. Do not apply FLOSEAL matrix in the absence of active blood flow, e.g., while the vessel is clamped or bypassed, as extensive intravascular clotting and even death may result. Do not administer to patients with a history of hypersensitivity to Recothrom thrombin topical, recombinant, any components of Recothrom, or hamster proteins. Do not use FLOSEAL matrix in patients with known allergies to materials of bovine origin. Do not use FLOSEAL matrix in the closure of skin incisions because it may interfere with the healing of the skin edges due to mechanical interposition of gelatin. FLOSEAL matrix is not intended as a substitute for meticulous surgical technique and the proper application of ligatures or other conventional procedures for hemostasis. FLOSEAL matrix is not intended to be used as a prophylactic hemostatic agent. As with other hemostatic agents, do not apply FLOSEAL matrix to sites where there is negative peripheral venous pressure, as material may be drawn into the vascular system, potentially resulting in life-threatening thromboembolic events. Excess FLOSEAL matrix, material not incorporated in the hemostatic clot, should always be removed by gentle irrigation and suctioned out of the wound. The particles of FLOSEAL matrix swell approximately 10 to 20% upon contact with blood or other fluids, and surgeons should consider its potential effect on the surrounding anatomic areas. Maximum swell volume is achieved within about 10 minutes. FLOSEAL matrix should not be used in the presence of infection. FLOSEAL matrix should be used with caution in contaminated areas of the body. The safety and effectiveness of FLOSEAL matrix for use in ophthalmic procedures has not been established. FLOSEAL matrix should not be used for controlling postpartum bleeding or menorrhagia. The safety and effectiveness of FLOSEAL matrix has not been established in children under 2 years of age and pregnant women. It is not known whether FLOSEAL matrix can cause fetal harm when administered to a pregnant woman or can affect reproduction capacity. FLOSEAL matrix should be administered to a pregnant woman only if clearly needed. Do not use air to remove residual FLOSEAL matrix from applicator tip. The applicator tips should not be cut, as tissue injury from sharp edges may result. Hypersensitivity reactions, including anaphylaxis, may occur. Recothrom thrombin is produced in a genetically modified Chinese hamster ovary cell line and may contain hamster or snake proteins. For single use only. Do not re-sterilize. FLOSEAL matrix should not be applied before the application site is cleaned to remove any antiseptics that may contain alcohol, iodine, or heavy metal ions. When placed into cavities or closed tissue spaces, gentle approximation is advised. Do not compress. As with other hemostatic agents, do not aspirate FLOSEAL matrix into extracorporeal cardiopulmonary bypass circuits or autologous blood salvage circuits. Do not use FLOSEAL matrix on bone surfaces where adhesives, such as methyl methacrylate or other acrylic adhesives, will be required to attach a prosthetic device. FLOSEAL matrix should not be used for the primary treatment of coagulation disorders. The safety and effectiveness of the combined use of FLOSEAL matrix with antibiotic solutions or powders has not been established. The safety and effectiveness for use in neurosurgical and urological procedures has not been established through randomized clinical studies. In urological procedures, FLOSEAL matrix should not be left in the renal pelvis or ureters to eliminate the potential foci for calculus formation. Antibody formation to Ricothrom thrombin occurred in less than 1% of patients. None of the antibodies detected neutralized native human thrombin. Thrombin must be added to the gelatin matrix prior to use. Rx only. For safe and proper use of this device, refer to the full instructions for use.